Good afternoon, everyone. We've hit noon, so we are going to get started today as we have a lot of great content to share with you all. So I am Jordan Shireen. I am one of our in-house registered nurses and one of our Kinetic Health Program managers.
And I am Sage Musson. I am a registered dietitian and also a Kinetic Health Program manager.
Yeah, and we are excited to talk with you guys today. This is actually session 2 of our Chronic Conditions 101 different webinars. If you guys tuned in a couple months ago, our Vice President of Kinetic Health, Sarah Michaels, went through diabetes, and it was actually one of our most attended webinars of the year. So we wanted to do another session focused on heart health, especially hypertension. So in celebration of American Heart Month for February, we're going to dive into that today. So to start off here, again, we know that February is American Heart Month. And so we wanted to start out with, why are our hearts so important? I think, we know that it's the central organ in our bodies, but why do we really emphasize the health of our hearts during this time? So the function of your heart, to put it simply, is to deliver oxygenated blood to your vital organs. So that's going to be your brain, your liver, and your kidneys. So how does it do that, you may ask? So when we take a deep breath through our lungs, that oxygen goes to our lungs and is taken into our blood. That oxygenated blood is then transferred to our hearts, which then has the big job of transferring all that oxygenated blood to our vital organs. How it does that is through something called a heartbeat, which I'm sure a lot of you have heard of. When you go to the doctor and they take out that stethoscope and press it against your chest, they're listening for that heartbeat. And there are two things that happen during that time. Your heart contracts, and then your heart relaxes. So when your heart contracts, that's going to be when it's doing the main job of pushing that oxygen out into your body. And so to start out, for a blood pressure, that contraction that your heart has is actually going to create something called your systolic blood pressure. So of course, this systolic blood pressure is going to be higher because your heart is doing the active work then. It's pushing all that blood where it needs to go. So that's going to be that top number in your blood pressure reading, usually in the 90s or the hundreds or so. And then you're going to have a second force. So this is going to be called your diastolic blood pressure. This is going to be a little bit lower because this is when your heart is relaxed, but there is still blood in your veins and your arteries, right? It doesn't just go away. So there is still a pressure that our body is experiencing during that time, but it's going to be a little lower. So we might see this blood pressure be about like 80 or 90 or so. So to give you a visual here, on the left side, you can see systolic blood pressure. On the right side, you see diastolic blood pressure. The mmHg that you see is just what we measure pressure in. So that's millimeters of mercury. I'm not going to go into the details of that. My professional credentials are not in physics, but that's just how we measure your blood pressure, so you're aware. But for instance, if you see a blood pressure and say it's 118/70, you would be in that green box because your systolic blood pressure is 118. That's well under 120, like we like to see. And then that 70, that diastolic blood pressure, we like to see you under 80, and that's a nice normal blood pressure. We'll dive into the specifics of this chart a little bit later, but this is just to help get started with a visual for you. So what is hypertension exactly, and why is it so bad for me? So simply put, hypertension is known as high blood pressure. This is going to be anything over that standard 120/80 reading that we just discussed in the chart before. Now, I do want to have a little disclaimer here. Our bodies naturally throughout the day have elevated blood pressures and lower blood pressures based on whatever we're doing. If you're working out, maybe your blood pressure is a little higher, or maybe you're running late to a doctor's appointment and your blood pressure is a little higher and you get there and your blood pressure is reading a little bit higher than it should. I don't know if you've experienced that, Sage.
Yeah, and I know some people kind of get nervous going to the doctor as well, so we call that white coat syndrome, and that can have an effect on your blood pressure as well.
Yeah, so that's not going to be an official hypertension diagnosis by any means. Hypertension is when there is a sustained number that is recorded on multiple dates above that 120/80 mark. So that's when your doctor will start talking about lifestyle modifications, which Sage will be going into later on in our presentation, or they might have to discuss some medication options for you should you need that. But the reason hypertension is so bad for our bodies is it does a lot of things. First of all, it wears out your heart and increases your risk for heart failure. And how it does this is because your heart has to overcome more resistance in your veins, in your arteries, to get the oxygenated blood where it needs to go, to your liver, to your brain, all those vital organs. So if you think of it like you're working in an office building, right? And you have one hallway to get from point A to point B. If I have 10 people in the hallway, it's going to be really easy for me to get where I need to go. I'm not encountering much resistance. I'm not going to be tired because I can just take a nice easy walk over to point B. However, if there's 100 people in that hallway, that resistance is now going to increase. What I'm going to have to overcome to get to point B might wear me out. I might get over to point B and I'm a little out of breath. That's what happens to our hearts when they're having to work really hard over time to get that blood where it needs to go. Hypertension also weakens our blood vessels and our arteries. So again, if you have this higher pressure in those veins and arteries, they're going to weaken. It can increase risks of aneurysms and whatnot. So that's a concern as well. So there are a number of factors that can cause this high blood pressure in our bodies. 3 of the main ones are going to be 1, high cholesterol. So again, think of that hallway getting increased with a lot of people. That's going to be the same picture we see with cholesterol. If there's less room for that blood to get where it needs to go, we're going to be encountering a lot more pressure during that time. There's also something called atherosclerosis. So atherosclerosis is just a fancy term for when our veins and our arteries don't have that easy ability to get bigger or smaller to accommodate for the demands that our body may have when our blood pressure increases or rises throughout the day. And unfortunately, our risk of this increases as we age. Unfortunately, our bodies do have a bit of a time clock, right? And so atherosclerosis does increase that risk of hypertension. And lastly, Sage will be going through this a little later, but high salt intake, this does affect the fluid balance in our bodies. And therefore, if we're holding a lot more fluid in our bodies, again, that's going to increase that blood pressure. Unfortunately, another concern with high blood pressure is that unlike other chronic conditions, it doesn't have very many obvious signs or symptoms until your blood pressure has actually started to affect your organs. So this is why we always encourage people to be going to their primary care providers, because oftentimes we don't know our blood pressure is high until we have that blood pressure cuff around our arm and we see those numbers are higher. Oftentimes, if we're to the point that we're experiencing symptoms like blurry vision or a headache or shortness of breath, oftentimes our blood pressure is really high at that point, and there are a lot more things we're going to have to do in order to get it to a controlled level. So that's why we emphasize that. Unfortunately, there are some long-term effects as well of hypertension. You're at higher risk for heart failure, for stroke, for kidney failure, and even blurry vision, because that increased blood pressure in your veins that are around your eye get worn out, and it can affect that ability to see. So that's why we emphasize definitely seeing your doctor on a regular basis. So you might be asking, okay, Jordan, I get that it's a problem, but how big of a problem really is this hypertension issue? And if you've ever heard me present before, you know heart disease is actually one of those things I'm probably the most passionate about, because it actually affects 50% of the US population. 50%, yeah, it's not few. 50% possibly of the people who are watching this webinar have hypertension. But then on top of that, 50% of those people who have hypertension, again, don't even know that they have it, because again, we don't experience those obvious signs and symptoms that we're like, hey, something's wrong with my body. So really important, again, to be aware of that. Unfortunately, hypertension, that high pressure in your veins and your arteries over a long period of time, it actually increases your risk for heart disease, which we have discussed, wears out your heart, right? And it also increases your risk for stroke. And unfortunately, these are the two leading causes of death right now in the United States. So it's a really important topic, again, which is why we emphasize your heart health every single year during the month of February. So you might be asking, okay, Jordan, yeah, that's a little concerning. I agree. But who is at risk for developing hypertension? And I have some bad news. It's actually all of us. So as we age, that is one of the main risk factors for hypertension, because our veins and our arteries, like we kind of discussed before, they might lose that ability to dilate or constrict and develop atherosclerosis, like we talked about. Personal story here, I actually have a grandmother who's in her 80s and is probably the healthiest person I know. She takes great care of her body. She does Zumba multiple times a week and eats really well. However, even with all of that, she does have to take medication for hypertension, because unfortunately her body now isn't able to adjust for those demands throughout the day. So again, aging is going to be a risk factor for that. We've already discussed cholesterol. Again, it increases that resistance in our veins and our arteries. So our blood has to work a lot harder to be pushed out to those vital organs. Caffeine and stimulants. This is actually something a lot of people aren't aware of. So coffee is a main source of caffeine that we see throughout the day. This can increase our blood pressure and cause a lot of issues with that.
Yeah, and I know we actually have a coworker in the office who was able to cut out caffeine, I believe a couple of years ago, completely cut it out, and his blood pressure has actually dropped by 30 points since then, which is a huge improvement for sure.
It's a bummer to cut out that coffee, but dang, if it decreases your risk for developing a lot of concerning things later on, it might be worth to cut down on that, and even cold turkey if needed. Sleep apnea, so this is something that can increase your risk of hypertension. And this, I have to explain kind of the reason behind this to a lot of people. So sleep apnea, when you're laying down in bed, this is when sometimes your body has to work a little harder to initiate a signal to your brain to breathe, but you're having some obstruction, right? You might be snoring or something like that. So oftentimes when your body's trying to initiate that breath, your heart is having to work harder to pump the oxygen that is in your body to wherever it needs to go. Again, wearing out your heart over time the longer you're dealing with that. So that can increase your risk of hypertension. Stress, this can raise your blood pressure, which I know Sage actually will be talking about a little more in detail later, so we won't go into too much detail about that right now. Chronic diseases. So there are two chronic diseases that will increase your risk of hypertension. One is something we talked about a few months ago. Again, I mentioned that webinar that our vice president did over diabetes. So diabetes is going to actually sometimes be a risk factor for hypertension. And here's the reason why. So the way that Sarah described when your blood sugar is high is because that sugar isn't able to get into the cells that it needs to in order to operate well. So if you've ever seen, like you make lemonade or something like that, and you put too much sugar in there, it increases the thickness of that fluid. And that's kind of exactly what happens in our bodies. When our sugar's high, makes your blood a little more thick, and therefore it increases that blood pressure. As well as kidney disease. So your kidney's job is to filter out different issues or toxins or fluid that your body doesn't need anymore. But if they're struggling to actually do that and filter out that fluid, it means your body's holding on to that fluid. So it's going to, again, increase that blood pressure and increase your risk of hypertension. And then lastly, unfortunately, some things we can't quite control. Race and sex do increase your risk of hypertension. So if you are Black, it can increase your risk, as well as the male population. Males do have a higher risk of heart disease and hypertension as well.
So now that Jordan has kind of gone over what hypertension is, why it's important to pay attention to that, I want to talk about some lifestyle modifications that specifically the American Heart Association and Mayo Clinic recommend that we keep an eye on, some specific habits. So this is separate from any prescribed medications. I want to point that out there. So if you are on any prescribed medications for hypertension, these are absolutely lifestyle modifications that you should be trying to focus on, but these are separate from medications. So unfortunately, we don't have time to talk about each one of these really in depth in today's webinar, but I do want to quickly point out that focusing on just one or two of these lifestyle modifications will likely have a positive impact on some other modifications within this list. So let's say, for instance, you start working on a healthy diet low in sodium. You're probably going to notice some positive changes when it comes to your stress or to your weight, and also probably your sleep. If you start working on managing your stress, you're probably going to notice some positive changes when it comes to your weight, your sleep, maybe how much alcohol you're drinking or how much you're smoking. So they're very much intertwined. But let's go ahead and talk about some of these in a little bit more detail. Obviously, with my background as a registered dietitian, the first thing I want to talk about today is a healthy diet low in sodium. But one of the first questions I typically get from clients and patients when talking about how to, keep an eye on your sodium intake for blood pressure, they want to know the relationship between the two. So sodium is an important electrolyte for our body, but one of the reasons it's so important is that it helps control fluid balance within our bodies. So sometimes consuming too much sodium will actually pull fluid into our bloodstream. And as you can imagine, if more fluid is being pulled into the bloodstream, that's going to increase blood volume. And with an increase in blood volume, that's going to make our heart have to work harder in order to pump that blood around the body. And so over time, this can be an extra burden on our heart and our blood vessels, and it can lead to, a long-term problem like hypertension. So that's how the two are related. When it comes to sodium, it's really tricky. There's a lot of sodium in a lot of different foods. It's not necessarily maybe that you add a lot of salt when at the table or when cooking, but it's already in a lot of foods. Think of foods from, fast food or restaurants. Think of packaged foods, sauces, condiments, all of that. Sodium is going to already be in that, whether it's for taste or preservation. So we recommend less than 2,300 milligrams of sodium per day. However, if you already have a diagnosis of hypertension or any type of heart condition, we actually recommend less than 2,000 milligrams per day. So the FDA actually estimates that the average American gets over 3,400 milligrams of sodium per day. So that's quite a bit more than the recommended amount. And I am not blind to the fact that this is a hard number to stick to, but it is doable and it is important for our heart health. So one of the first quick tips that I wanted to point out, I took a nutrition facts label from Lay's potato chips, which we all love.
Delicious.
And so that is the nutrition facts label that you see on the left. And so my quick tip is that if you take the amount of calories per serving versus sodium, if that sodium is higher than the amount of calories, we would consider that a high sodium food. So on this nutrition facts label, you can see that the calories are 160, but the sodium is 170. So we would consider this a high sodium food. That doesn't necessarily mean that you can't have this food or you should cut it out completely. That's not what I'm saying. But if you do decide to have this high sodium food, we would just ask that you watch your sodium intake for the rest of the day. Make sure you're being mindful of how much sodium you're having at your meals and your snacks. So I don't want to say this to scare you, and I think a lot of people in the office have seen this and heard this now, and they're kind of like, oh my gosh, I've really been watching it, which is great. That's what we want you to do. But again, it doesn't mean that you can't have this food. It's just a way for you to be more mindful.
Yeah, I think that's something that actually our team, when we were researching this a couple of weeks ago, they were really surprised by that. I hadn't even learned that. And
yeah.
So I think that's really helpful.
Quick tips are always helpful.
Yes.
A couple of other tips to cut back on sodium intake. So like I mentioned, adding salt when cooking or at the table isn't necessarily where we're getting the most sodium, but it is a great way to cut back if that's something that you are prone to doing. So try herbs and spices instead, salt-free seasoning mixes, lemon and lime. Those are great ways to flavor your food without using salt. If you're questioning a salt-free seasoning mix, it'll usually say salt-free, or you can just check the ingredient list to see if there's salt in the ingredients. Look for low sodium or no salt added condiments, sauces, all kinds of different foods, canned foods. Or if you're just not ready to jump over to the low sodium or no salt added train, I get a lot of pushback on that one sometimes. Just try to use less of regular condiments. Limit instant products. So think of your microwavable rice, your powdered or like instant mashed potatoes, hamburger helper, things with like seasoning that come with it, those are typically going to be pretty high in sodium. And lastly, read the nutrition facts label. That's your biggest helper when it comes to determining what's in the food that you're eating. So again, using that quick tip to just check the calories and sodium, that can be a good way to check how much you're getting. So I think we always find a way to talk about a healthy diet in all of our webinars. So I'm not going to go into the basics of this, but something that I did want to address when it comes to a healthy diet is including more fiber. So Jordan talked about high cholesterol being a risk factor for hypertension. And so I think something that's really underrated when it comes to watching your diet is trying to include more fiber. So we get fiber from fruits, vegetables, whole grains. Those are great ways to increase our fiber intake, which can actually lower your cholesterol levels, which means that's great for your heart health. The recommended amount per day is 25 grams. Unfortunately, most Americans do not get 25 grams of fiber. So I really want to challenge you to think, what can I be adding to my meals? What can I be adding to my snacks to get more fiber in? That's a great place to start. So now we're going to talk about exercise. Again, I think probably something that everybody's really used to hearing about when it comes to heart health, including more exercise. But I wanted to take a step back and talk about how are regular exercise and the heart related. So when we exercise, it helps strengthen our heart muscles. In turn, that helps the heart more efficiently pump blood to the lungs and other parts of the body, which means more blood flow to our muscles and higher oxygen levels. It also reduces stress hormones. So I'm going to talk in a little bit about stress and how that's related to blood pressure, but that's another great benefit of including more exercise. It reduces those stress hormones, which can be an extra burden on the heart. It can increase HDL cholesterol, which is our good cholesterol, and it can also help our triglyceride levels. So I always recommend, talk to your doctor about what type of exercise is right for you. But the American Heart Association recommends a combination of aerobic exercises and resistance training. Again, talk to your doctor about how you can fit these in safely into your routine. But if you're wondering what aerobic exercises are, it's something that kind of gets your heartbeat going a little bit faster. So we're talking anything from walking, jogging, biking, maybe you like to swim. Those are all great aerobic exercises. When it comes to resistance training, that's going to be things like weightlifting, body weight exercises, something that puts a little bit of tension on your muscles. So the recommendation is 150 minutes of moderate intensity activity per week. So if we break that down, that ends up being about 30 minutes, 5 days a week. But you don't always have to do 30 minutes at a time. Maybe you have a good time to take a break at work and you can take a quick walk, 15-minute walk. So then that means that you only have to fit 15 minutes of activity somewhere else in your day. Or I want to challenge you to think about how much time you spend doing things that you could easily replace exercise with. So maybe scrolling on social media or watching your favorite Netflix show. How can we easily fit that 30 minutes in somewhere?
I think a lot of people get a little intimidated by that 30-minute time frame, especially, if you're busy, it's a busy time of work, or you have little kids running around, it's hard to find that 30-minute time frame. Some movement is better than no movement. So even just like 10 minutes in the morning to go on a walk around the block with the dog, or like you mentioned, maybe during a lunch break during the day, you take 10 minutes to walk around the office, or instead of sending an email, you walk over to the colleague that you need to talk to. Just finding that time is still going to be worthwhile and add up over that course of time.
Absolutely. Don't make it more difficult than it needs to be. So how are stress and sleep related to blood pressure? Two things that I think are very underrated when we consider heart health and blood pressure. So first I want to talk about stress and blood pressure. So when under stress, the body releases hormones, whether that's cortisol or adrenaline, and these hormones result in increased heart rate and narrowing of the blood vessels. So that's going to increase blood pressure. I want to point out that stress has not been linked to long-term high blood pressure. It's only been linked to short-term blood pressure. However, when we consider the things that we typically turn to when it comes to being under stress, I want to challenge you to think about what you turn to. Do you maybe reach for unhealthy foods, those comfort foods? Do you smoke more? Do you drink more alcohol? Do you maybe just sit on the couch for hours on end and watch TV? Those habits are linked to long-term high blood pressure. So even though they may not be linked, stress may not directly be linked, those habits are. And so when we're under stress, we tend to turn to those habits. When it comes to sleep and blood pressure, when we're sleeping, our body naturally decreases blood pressure. However, if you're having a hard time staying asleep, maybe you're awake and then asleep and awake and asleep, your body isn't able to really decrease blood pressure to where it needs to be. So it stays elevated for a longer period of time. In addition to that, it's actually really important for hormone regulation. So sleep specifically helps with hormone regulation, especially those stress hormones that I just talked about. And so you can see how these are all kind of intertwined. If we're not having good hormone regulation, that's going to affect our stress. And we talked about how habits, can affect stress and all that. So very much intertwined, very much something we want to be focusing on as a whole big picture. So when it comes to sleep and stress management, two things that I'm very, very passionate about are developing morning and nighttime routines to improve your sleep. So when it comes to a nighttime routine, I always recommend try to put your phone or your laptop away at least 30 minutes before bed. Try to turn down the lights, get your body naturally producing some melatonin to get you ready for sleep. Try to do a relaxing activity. Maybe it's taking a bubble bath or reading, something to get you relaxed and ready to fall asleep. When it comes to morning routines, have a good breakfast. Try to get natural light in your eyes. Don't automatically reach for your phone. Drink your water before your coffee. All of those types of things are really going to set you up for a good day, but also a good night of rest. And when it comes to stress reducing activities, this is going to look a little bit different for everybody. Some people like to exercise as stress reduction. Some people like to read or cook or garden. But figure out what works well for you and try to figure out a way to incorporate that more into your daily routine.
Now, if you've been diagnosed with hypertension, I really encourage you to make sure you're following up on what your doctor recommends for you to be monitoring that. Oftentimes, they'll usually say to have a blood pressure machine at home. Oftentimes, they will have different brands that they recommend, so I would make sure to talk with them about that. But there are a couple things I would advise you on when you are monitoring your blood pressure at home. One, make sure you're consistent with the times that you're doing that. Like we said, your blood pressure can go up and down throughout the day. So making sure you're consistent with the timing of you assessing that blood pressure. Also making sure that you're evaluating for potential for maybe not accurate readings, some false readings. I've had some friends who have been pregnant in the past who they've had to monitor their blood pressure and they'll see this really high number and get alarmed. I always advise them, hey, take 10 minutes, walk away, come back, reassess. If you have two readings that are high blood pressure, then maybe reach out to your doctor, but don't jump to worst case scenario if you see one abnormal reading there. So yeah, we advise you guys to just be aware of that and make sure you're talking to your doctors. Resources. So I included a resource here, as I know there's so much information about heart health and hypertension that we didn't get to cover today. But we have our citations and resources here that can help you to implement some lifestyle modifications as far as, cutting back on salt if needed, or there's also some helpful tools and resources from the American Heart Association that you can look through these links to review.
And these are our citations. And lastly, we just want to see if there were any questions or comments throughout the presentation that we can answer for you all.
There's one I see. So I was diagnosed with high blood pressure and I'm pregnant. Will this put me at higher risk for blood pressure for the rest of my life?
So I would say definitely talking to your doctor about that, having a good open conversation is important. But unfortunately, pregnancy just does change your body. There's a lot of things that are adjusted, and as you're accommodating for growing a person, your body is a little overwhelmed with that, and that's totally fine. It doesn't necessarily increase your risk for hypertension later on, but it will be something your doctor monitors after you have your baby just to be aware of. That's a great question, though. All right.
All right. It looks like that's it. So this is it for our webinar today. March 26th, we're going to be talking about the fundamentals of health insurance with our in-house educator, Tony, and one of our account executives, Brandy. So make sure to join us March 26th at noon. And thank you all for joining us today. Have a great rest of your day.
Thank you.